Welcome to our community conversation with the Social Security Administration. My name is Janine McDonough. I'm the Vice Chair of the Aurora Advisory Commission on Disabilities. And I want to thank the Social Security Administration for joining us today. I also want to thank the Mayor's Office and especially Clayton and Alex for helping organize and facilitate today's conversation. Today's topic is one that I've been wading through for the last several years with my young adult son who's on the autism spectrum. It's a topic that comes up all the time in my circle of special needs friends. We always have a ton of questions about it, and we're happy to have the team from Social Security Administration join us today to answer some of your questions.
All right, well, good afternoon. My name is Eric Martinez. I'm the Deputy Regional Communications Director for the Chicago region here. But before we get started, let me thank the City of Aurora's Advisory Commission on Disabilities. And I want to give a special shout out to Alex Voigt, the Deputy Chief of Staff at the Mayor's Office, who have given us this opportunity to be with you here today. But thank you for making Social Security part of this broader discussion to assist the citizens of Aurora with the many questions they have. But before I get started, let me introduce my colleagues here. First and foremost, I want to introduce Megan Forrestal. She's our Public Affairs Specialist here in the Aurora area. And with me also is going to be Josephine Wheeler, who is a Public Affairs Specialist in the Chicagoland area. But today's presentation is going to focus on Social Security disability and supplemental security income, otherwise known as SSI. So it's hard to talk about Social Security in 30 minutes, but we're going to do our best to wrap it up for you. But before I get started, let me just bring forth some housekeeping items here. First and foremost, I want folks to know that the Aurora Social Security office remains open as we're providing service by phone and online. Now, due to the COVID-19 pandemic, you can only enter our offices if you have an appointment. Now, this decision protects the vulnerable population we serve, which are older Americans and people with underlying medical conditions. And of course, our most important asset is going to be our employees. While we do offer many online and phone options to go ahead and help the citizens of Aurora, I recognize that in-person assistance is absolutely necessary in some occasions. With this said, we may be able to schedule an in-person appointment in certain situations. What we've done is we've updated our information on our coronavirus COVID-19 webpage to explain these situations. Now, if you believe you qualify for an in-person appointment, please call your local office. I'll show you how to get all that information in today's presentation. Next slide. Let's first talk about how we receive funding here at Social Security. A U.S. federal payroll tax is deducted from each paycheck, also known as Federal Insurance Contributions Act, more known as FICA. This is how Social Security tracks your earnings throughout your lifetime and how you earn Social Security retirement disability, survivors coverage for not only you, but your family as well. Now, this tax is going to be collected from both your employer and you to fund Social Security and Medicare. The total FICA tax is going to be 15.3% of your gross wages. 7.65% is your responsibility, and of that, 6.2% goes to Social Security and 1.45% goes to Medicare. Please note that the money you pay in taxes is not held in any personal account for you to use when you get these benefits. What we do is we use your taxes to pay people who are getting benefits right now, hence the term social insurance. But here in 2020, we've got about 180 million workers who will pay Social Security taxes this year. That covers about 94% of all workers who are covered under the Social Security system. Next. Here at Social Security, we administer the largest disability program in the nation. We like to say that we're with you throughout life's journey, touching the lives of nearly every single American, often during times of personal hardship, transition, and even uncertainty. Our programs serve a vital financial protection for the working men and women of America. Now, we understand that a disability could happen at any moment in our lives, and Social Security disability benefits provide that financial support to people when they need it most. For people who can no longer work due to a disability, our disability program is there to replace some of their lost income. Disability benefits provide modest coverage for severely disabled workers and their dependents. And to give you an idea of what that average monthly benefit is this year, it's right around $1,122. Next. The Social Security Administration defines disability as a person who cannot work due to severe medical condition that has lasted or is expected to last at least 1 year or result in death. The person's medical condition must prevent him or her from doing substantial gainful employment, and we'll explain that later on in our presentation. But that's pretty much work that he or she had done in the past, and it must also prevent them from adjusting to other similar like work. But let's get into the details about Social Security disability and supplemental security income. So at this time, I want to turn it over to our public affairs specialist in the Aurora area, Megan Forrestal. Megan?
Thank you, Eric. So we're going to start by talking about one of our 2 disability programs we administer through Social Security, and that is Social Security Disability Insurance, or SSDI. This is the one, as Eric was discussing, you're working and paying into by paying those FICA taxes. This is for individuals who are unable to perform substantial work, as mentioned, having a medical condition that's expecting to last at least a year or resulting in death. You must be under full retirement age and earning less than that substantial gainful activity. So substantial gainful activity is actually a dollar figure in how we're determining what someone can perform as far as our definition of disability. For 2020, our definition of substantial gainful activity is earning $1,260 gross a month or more. For 2021, that's going to go up to $1,310 gross a month. Now, within our disability programs for both disability and SSI, which I'll talk about, we have different provisions for individuals who are blind or visually impaired. And you can learn more about those specific provisions on our socialsecurity.gov website. For Social Security disability, what we're looking for to determine, once we determine if you're working under that substantial gainful activity, we need to see if you have enough recent work and enough overall work to be insured for the Social Security disability program. As far as recent work, what we're looking at depends on how old you are. So when you're younger, 21 and under, or 24 and under, I apologize, we're looking at about a year and a half out of the last 3 years of work before becoming disabled to be insured for the program. Between 24 and 31, that goes up to having worked half of the time since the time you turn 21 to the time you become disabled. And then at age 31 and over, we're looking at whether you've worked at least 5 of the last 10 years before becoming disabled. Now, to find out if you meet these recent work tests as well as our overall duration of work test, you can check that out in your My Social Security account, which Eric is going to talk about later. So if you have a benefit estimate listed for disability, that means you qualify for the recent and overall work test for disability. Now, if someone is awarded disability, we do have a lot of different work provisions, work incentives that we have that allow you to test out an ability to work without worrying about losing immediately your Social Security disability insurance or any Medicare that you have through us. So if you do have a job or become self-employed, then what needs to happen is if a person's on benefits, we need to know about that work right away. So we want any individuals receiving disability to notify Social Security if they start or stop work. Also, if there's any changes in job duties, hours of work, or rate of pay. Now, once someone has let us know they've started work, though, they can actually report wages online to us in their My Social Security account. So they don't have to worry about mailing in pay stubs or faxing in pay stubs to the office every month. For more detailed information on our work incentives, because it's a lot to cover in our time today, we wanted to just give you a good resource to use to find out more on those work incentives. And that's our Working While Disabled, How We Can Help publication. You can see the link here listed on the slide. If you missed the link, if you go to the search box on socialsecurity.gov, you can type in the publication name as well, and it'll take you there. But it does have all the details on our different work incentives within that publication. Now, I'm not going to get into too much on taxation because we do refer individuals to IRS with any tax questions. but I just wanted to give you some basic information on taxation of Social Security. So if you're filing as an individual with over $25,000 or a joint return with over $32,000, just know that you may have to pay taxes on that Social Security benefit. And for any more details, like I said, you'll want to contact IRS directly. So we talked about Social Security disability insurance, and now I want to talk a little more on Supplemental Security Insurance, or SSI for short. This is a federal needs-based program. So this is for individuals with limited income and resources. We have this program for anyone age 65 or older who has the limited income and resources. This is what we call an aged benefit. We also have SSI for individuals of any age, including children who are blind or who have disabilities. With SSI, this is something we have take a comprehensive look at all income and resources of the applicant. If the applicant is married with a spouse in the household, we're also looking at that spouse's income and resources. For children, we're looking at any parent in the household's income and resources. And I'm just going to go through some of the maybe most common types of income and resources we see, but it's not a comprehensive list because we do really look at everything when it comes to SSI. In addition to income and resources, we also look at where someone lives. So someone does need to reside within the United States or Northern Mariana Islands to receive from the SSI program. I also want to note we do have some specific policies for permanent residents and certain lawful aliens. And while we don't get into those specifics today, those are available on our website or by questioning, calling the Social Security office for more information. So just some more common types of income we look at for SSI. In the earned category, we look at gross wages, net earnings from self-employment, payments from services and sheltered workshops. And as far as the unearned side, some of the most common would be Social Security, veterans, unemployment, interest, pensions, and even cash given from family and friends can affect an SSI check. With SSI, we do have some resources we exclude. Most commonly, they're the home in which someone lives, one vehicle. Generally, it's going to be the vehicle which is the highest value as long as it can be used for transportation. Also, burial plots for the applicant and family members. And we have some specific policies with some prepaid funeral expenses or resources set aside for burial. Those are all things we have to look into when someone has something in their name during the course of the application. But things we're always generally looking at is bank account balances, including CDs and IRAs, stocks, bonds, 401ks, a second vehicle, life insurance, like if it has a cash surrender value, we're going to consider that, and property other than where someone lives. With SSI, another thing we're looking at is living arrangements. So we look at living arrangements to determine how much of a monthly payment that we can pay an individual. If they are living in someone else's household, then we're not going to pay them a full check unless they're paying their fair share of bills in that household. If someone is in a nursing home or other institution where Medicaid is paying more than 50%, then they're generally only going to receive $30 a month from the SSI program. And then we have some specific policies where we have to look at individual case-by-case basis for individuals in group care or boarding care facilities to see how we determine payment at that facility. With SSI, individuals on the program generally have to report pretty much any changes. So this list on the screen is not an entire list of reporting responsibilities. These are just some of the most common that we see. So change of address, living arrangement, changes in earned or unearned income, changes in resources, marital status, changes in citizenship or immigration status, or if someone is leaving the country for more than 30 days, that's another common thing we need reported to us. change in school attendance for any children in the household under age 22. So like I said, there are a lot of other reporting responsibilities. If you're interested in getting the entire more comprehensive list, you can use that publication we have listed here on the screen, the Supplemental Security Income publication. And there is also a lot of other additional information that you can find on that socialsecurity.gov website on the topic of SSI. So as we mentioned earlier, requirements as far as the disability aspect for children are different than an adult. So of course, with children, we're not looking at their ability to perform substantial work. What we're actually looking at is a combination of any physical or mental impairments that result in marked or severe limitation in functioning. So we're going to look at, their ability to function relative to other children, their age, look at their developmental milestones, all those sorts of things. The child must be blind or disabled, just like an adult, and the same part of the definition as an adult is the condition must be expected to last at least 12 months or result in death. As I mentioned earlier, with children, we're also going to look at parents' income in the household. So it's only the parent that the child is residing with that we're looking at their income and resources. And we're also, of course, going to look at the child's own income and resources. So some common examples of an income that children might have are child support, Social Security benefits off a parent's record, or gifts they receive from family and friends. So to get a little more idea on specific topics regarding SSI, we have this great section on the socialsecurity.gov website called Supplemental Security Income Spotlights. So if you're interested in learning anything more on the topics that we weren't able to cover entirely during this presentation, I recommend you checking the spotlights out. You can see there's the living arrangements, the rights and responsibilities. Those are some of the topics we've talked about today. There's sections on ABLE accounts or Achieving a Better Life Experience accounts. You can look into more information on that. So a lot of great resources in that spotlight section. And just to kind of summarize the differences between Social Security disability and supplemental security income. So SSDI, as again, that's what you're working and paying those FICA taxes on. It's a Social Security trust fund based on your earnings, whereas SSI comes from a general fund, not the Social Security fund. So completely separate funds they're coming from, and not at all based on a person's earnings for SSI. For Social Security disability, it's an insurance that you're working and paying into with your job. SSI is that needs-based program. It does not require any sort of work history to receive from. For Social Security, it does not matter if you have $1 million in the bank account, you can still receive that Social Security check because we do not look at any resource limits, and the only type of income we look at is your own wages or net earnings from self-employment. And then for SSI, again, we have those limited income and resources. So resource limits for an individual is $2,000, for a couple is $3,000. So a lot more restrictive on that aspect for the SSI program. Social Security disability is for the workers who have paid into the program, as well as their adult disabled children who can receive off the record. So adult disabled children have to be disabled prior to age 22, and they can potentially get off of a parent's record. Whereas SSI, it can be any age. Again, it can be for children or adults with disabilities or individuals over age 65. Now, when you file for a medical decision from either or sometimes both programs we send out for the medical decision, you could receive a denial. And if you are denied and you're not able to work substantially still, or if the child that you're filing for still has an impairment, you want to make sure to file the request for reconsideration. That's the first level of appeal. The next level after that would be a hearing. All levels of appeal can be done online through the hearings level. We also, if we should be denying you for a non-medical reason, you can request a reconsideration on that aspect as well, right on our socialsecurity.gov website. Once someone is awarded, they might be told that we feel that they might need assistance in managing funds. So if we find someone is not capable of managing funds directly, we're going to look to assign a representative payee for that individual. So generally, representative payees are usually relatives or friends, occasionally an institution where that person might reside, who manages the person's funds on their behalf. When someone is assigned a representative payee, they have no direct access to their funds. So we really need to thoroughly investigate anyone who we appoint to be a representative payee for a beneficiary, because they do have total control of the Social Security funds. And we're always going to try to talk to the beneficiary as well and include them in the decision-making process. But ultimately, we're going to be the final say on who is appointed a representative payee. Once a representative payee is appointed, they're able to do the Social Security as well as any Medicare business for the individual they're payee for. So representative payee is an entirely specific issue to our agency. We do not recognize power of attorney, and representative payee is not necessarily going to be recognized anywhere outside of our agency or Medicare. If someone is appointed a representative payee, we have a portal through the My Social Security account that lets individuals who are payees manage direct deposit, wage reporting, or even do the annual reporting forms they might be required to complete for us. As far as health insurance through Social Security's programs, we have Medicare. That is something that someone is automatically enrolled into. It's a federal health insurance program, and you're automatically enrolled after 24 months of disability. And then we have some separate policies for people who are age 65 for Medicare. Then Medicaid is administered through the state for individuals with low income and limited resources. Now, in the state of Illinois, Medicaid does not come automatically with SSI eligibility. So generally, individuals who are approved for SSI usually qualify for Medicaid. However, that needs to be a separate application done through that state agency to determine eligibility. As far as Medicare goes, at Social Security, the only thing we're doing with Medicare is enrollment in Part A and Part B. So Part A is the hospital insurance. If you're insured for Social Security disability, there is no monthly premium for that insurance, but there are some deductibles, and that's inpatient stay only. Part B, your medical insurance, that's outpatient doctor's visits, outpatient procedures, and certain medical supplies. That does have a monthly premium as well as a deductible. Part C and Part D are handled by private companies. So we're going to refer you to Medicare.gov for any assistance in seeking out those Medicare Advantage plans or prescription drug plans, or we're going to refer you to the Senior Health Insurance Program. So if you have difficulties with wading through the Medicare.gov website and you're unsure of the plans you're looking to get, I really do recommend you looking for the Senior Health Insurance Program counselor. Now, the name senior is a little misleading because this program does actually assist individuals 18 or older with disabilities as well. So this is where you can contact to get one-on-one counseling for assistance in figuring out those Medicare Advantage plans, the Medicare prescription drug plans. They even assist with a program that we administer called Extra Help, which helps pay for the prescription drug plans. So again, really great resources. You can call the toll-free number to find out, to talk to a counselor or get referred to a local counselor if you prefer to work with one that way. If you live in Illinois, that number on the screen there for you is 1-800-252-8966. We work with SHIP counselors a lot at our job, and they do an excellent job in assisting people in wading through all the Medicare.
All right, thank you, Megan here. So Megan's walked you through Social Security disability and SSI here. So I want to walk you through the latter half of it and some of the questions we get that are more frequently asked questions here. So one of those is going to be, when should I apply for disability benefits? And you know, when I get asked this question, I tell people two things here. You apply as soon as you become disabled and as soon as you stop working due to your disability. Now, why is that? Well, it's because the whole disability process can take, on average, anywhere from about 3 to 5 months total here. We want to make sure that we get you at the earliest possible point, and that's the point that you become disabled or you stop working due to your disability. Next. Another question we get is, how are we applying for benefits? Well, during the pandemic and always, the easiest and the most convenient option by far is for you to apply online. You've heard Megan talk about it. I'm going to keep on saying it. I'll say it again. It's socialsecurity.gov. It's by far the most convenient way for you to apply for disability benefits. Now, you can also call our 1-800 number. It's 1-800-772-1213. You can call them and schedule an appointment. Now, when you schedule an appointment, the local Social Security office will call you at that date and time that you're scheduled for your appointment, and they'll call you and take all the information over the phone. Next. We've talked about some resources. Megan's talked about some of the pamphlets that we have, but by far the most important resource that I'm going to leave you here with today is going to be our website. It's a wealth of information. It's socialsecurity.gov. Now, if you want to file for disability, it's as simple as clicking in the top right-hand side where it says disability. If you want to know more about our online services and what you can do online, you can go ahead and click on that tile right below it. Or if you want to hear about how COVID-19 is impacting Social Security operations, as I said in the beginning of my presentation, you can click on the COVID-19 and get all of our updates there. Or if you want to be like our other 53 million My Social Security account holders, you can create a My Social Security account by clicking on the bottom left-hand side. Next. Now, My Social Security is going to be an easy, convenient, and a secure suite of services that's designed to put you in control of your own personal Social Security information. It also helps you manage your benefits when you are ready. Your accountant gives you this information you need whenever you want, all without having to call our field office or visit the field office. Now, your online My Social Security account provides a variety of information for you to help you and your family. But if you need help setting up that account, we have a 4-minute walkthrough video on YouTube that will take you step by step on how to create that account. Next. All right, fraudulent phone calls here. This is something that we hear a lot from the community, and it's no different here in Aurora. I want to let people know that here at Social Security, we do contact individuals. Generally those who have ongoing business with Social Security, and you'll know about that. We're never going to call you out of the blue. Social Security employees will never threaten you with information. We will not state that you face potential arrest or any other type of legal action whatsoever. In those cases, that call is fraudulent. It's a scam. Aurora, don't be fooled. Just hang up. Don't give them any type of information, whether personal or any type of information at all. Now, most importantly, you got to let us know about that. Here at Social Security, we don't know what we don't know. You've got to report those fraudulent phone calls online at oig.ssa.gov. Or if you're more comfortable doing it by phone, you can call our 1-800 number at 1-800-269-0271. Next. All right, now in terms of contacting Social Security, now we've talked about our website, socialsecurity.gov, our toll-free number too as well, which is 1-800-772-1213. But most people are going to be contacting their local Social Security office. But what happens if you don't know what that field office is or what that field office phone number is? Next slide. Well, you can go to socialsecurity.gov and you can visit what's called our field office locator. All you have to do is, no matter where you live, you just put in your zip code and hit locate. What's going to end up happening is going to give you your call-in information for the field office that's closest to you, so you can call them immediately if you need any information from them. Next. Last but not least, if you want to stay up to date with all the changes that are happening here at Social Security, you can enroll on this page you see right there in front of you. You can enroll into email or text updates to get the latest changes and what's going on here at Social Security. Next. Last but not least here, I want to just mention, we talked a lot about information with regards to Social Security disability and SSI, and I know it's kind of tough to wrap up in 30 minutes here, but for the most part, we've done our best to go ahead and give you the, high level overview of the disability program. But if you're in need of more information, as I said, go online, contact us, contact your local Social Security office. But you can also follow us on social media at Social Security on Facebook, on Twitter, Instagram, LinkedIn, YouTube. Follow us to get additional information here. But again, I want to take a minute just to say thanks to Janine and say thanks to Clinton for giving us this platform to have this discussion with the citizens of Aurora. We sincerely appreciate the opportunity to go ahead and address the citizens of Aurora and look forward to also doing that in the near future. But on behalf of all of us here at Social Security, please stay safe and thank you for the opportunity.